The earliest whisper of something truly extraordinary began when doctors Maitre and Ellison published a brief report about a patient who should have died on the operating table. He had been lifted from an unprecedented traffic disaster, crushed ribs, shattered pelvis, and internal bleeding that no typical medical procedure could halt. Yet, as they transfused blood and attempted to keep his lungs from collapsing, the man's body began knitting itself together in ways science had never documented before. At first, the doctor scrambled with every known technique just to keep him alive. Sutures parted to reveal fresh pink tissue that this patient regenerated by the hour. Intrigued and alarmed, the surgical team tested again and again, yet found no ordinary explanation for how such catastrophic injuries could heal so quickly. Within 3 days, the patient who should have perished lay comfortably awake, conversing as if nothing had occurred. 2 more days and he walked out of the hospital, albeit shakily, under his own power. The hospital staff, and later the world, struggled to believe this was not some elaborate hoax. When news first leaked, even before peer review, people were quick to dismiss it as wishful thinking or worse, sensational journalistic fiction. After all, the phenomenon of spontaneous healing belonged, in most minds, to myths or cryptid rumors. The handful who believed were enthusiasts of fringe science, convinced that secret government experiments lurked behind the curtains. Yet data was data, and Dr. Ellison worked tirelessly to replicate and analyze every microscopic detail of the patient's remarkable tissues. He found that while the exterior layers of the man's skin revealed typical human cells, deeper tissue examinations uncovered a level of cell regeneration akin to that of certain amphibians. Skeptics pointed out the potential for data contamination or scribbled in the margins about improbable coincidences. But the phenomenon would not remain confined to a single case study, and more stories began to emerge. Patient after patient, each with a seemingly fatal wound, started displaying similarly accelerated cellular regeneration. Some had deep gashes that knitted shut within a day, where once they would have needed staples and weeks to heal. Others had broken bones that, on repeat X-ray, displayed faint hairline cracks, sealing themselves at a faster pace than any human had exhibited in known record. If something was truly changing across humanity, the global medical community needed to investigate. Was this a bizarre mutation, an adaptation, or the first sign of an entirely new stage in human evolution? Hospitals erupted in a flurry of tests, and laboratories across continents began exchanging encrypted data. Governments engaged in top-secret summits, wanting to know if some new pathogen, or perhaps a cosmic radiation effect, had triggered shifts in the human genome. Chaos reigned in the media, which churned out sensational headlines about zombie genes or immortality virus. Scientists pleaded for calm, but the public skepticism mixed with a fervent hope. Could humans truly be defying the boundaries of death? From the vantage point of the World Health Federation, Dr. Maitre coordinated an ambitious multi-nation study. Each facility scoured patient records in search of abnormal healing incidents. At first, the data was sparse. Only a handful of individuals showcased rapid wound closure. But as the months passed, the phenomenon spread, or possibly it had been underreported all along. Data from underdeveloped regions, where advanced diagnostics were rare, poured in. Stories of children who endured lethal injuries from civil conflicts only to miraculously recover. Gory accidents in factories leading to severed limbs that reattached themselves with minimal scarring. Doctors in the field had dismissed these as exaggerations, or credited non-traditional healers and spiritual interventions. However, with a new lens of scientific curiosity, the correlation was undeniable. Humanity seemed to be developing an elevated capacity for tissue regeneration, though the triggers and underlying mechanisms remained unclear. The impetus to dig deeper was urgent. Medical experts realized that they had to separate anecdotal hype from genuine biological changes. Rumors and conspiracy theories only grew. Some insisted this was an alien intervention orchestrated by reptiles from distant stars. Others believed it was the product of a secret laboratory that had tainted the global water supply with an untested agent. The established scientific community tried to focus on cold, hard evidence. Dr. Ellison and a small team of colleagues traveled to remote locations, collecting tissue samples from people who displayed unnatural healing. They performed on-site tests carrying portable gene sequencers the size of briefcases. The results were mesmerizing. A portion of the population carried something new, a gene cluster previously unknown, showing a capability of protein production that could energize and reconstitute cells at unparalleled speeds. In some individuals, the cluster was partially active, granting advanced but not extraordinary regenerative benefits. In a smaller fraction, it was fully active, leading to radical, near-miraculous recoveries. As data poured in, ethical dilemmas multiplied. Governments feared that militarization of this new biological advantage could tip global power balances. Pharmaceutical giants felt threatened, wondering if this emergence of healing from within would collapse entire industries. Meanwhile, everyday people who possessed the gene cluster found themselves bombarded with invitations to covert testing programs, unscrupulous black market research, or even abductions by extremist groups hoping to harness these abilities. The phenomenon had become enveloped in political, economic, and moral battles. Humanity was poised at a threshold. Would such a power transform society for the better, or plunge it into new forms of conflict over who got to be immortal? Amid this frenzy, one of the biggest breakthroughs occurred in a small clinic in Alaska. Dr. Soon Kim, a virologist turned immunologist, had been testing how the new gene cluster affected white blood cell counts in a group of volunteers. Using a specialized scanning microscope, Dr. Kim's team observed the phenomenon in real time. The subject's blood cells regrouped and replenished at an unbelievable rate, even under stress conditions meant to simulate severe infection. After injecting a harmless viral agent, the volunteer's immune response flared with methodical precision. In test after test, pathogens were neutralized in minutes rather than hours. This astonishing discovery suggested that the same mechanism mending torn flesh also enhanced immunity. The implications were vast, from ending pandemics to eradicating diseases that once ravaged the human body. Indeed, Dr. Kim's clinic soon became a beacon of hope, attracting both grateful families and suspicious corporate interests. While such healing capabilities began hinting at extraordinary benefits, a quieter faction of researchers sounded warnings. Dr. Bisht, a geneticist from Mumbai, expressed concern over potential side effects. To replicate cells at such speed, the body might risk genetic copy errors, leading to cancerous growth or autoimmune disorders if this new gene cluster malfunctioned. How many times could tissues replicate perfectly before hidden mutations accumulated? And what cost would this impose on the body's metabolic processes? Early data from a few luckless individuals suggested that while some soared through intensive healing spells, others saw partial organ failure. Indeed, for a small minority, the body's attempt to rejuvenate triggered an overreaction, creating monstrous tumors that overwhelmed them in days. The healing miracle, therefore, was not absolute. It had rules, limitations, and a real possibility of lethal backlash. Driven by a surge of altruistic optimism, Dr. Ellison co-founded the ReGene Project, a global collaborative aiming to refine and harness these newly discovered genetic pathways safely. The project's laboratories spread across multiple continents, each receiving specialized tasks to disentangle the complexities of accelerated regeneration. One facility focused on perfecting organ regrowth, testing whether entire livers or kidneys could be reconstructed in situ. Another specialized in neural tissue regeneration, attempting to help patients with severe spinal injuries walk again. Early trials had encouraging results, yet the fear of an unintended meltdown always lingered. In the midst of this uncertain frontier, the world watched in awe and trepidation as ReGene scientists attempted the seemingly impossible, orchestrating complex organ regrowth in extremely damaged bodies without triggering catastrophic meltdown. Media calls for complete transparency pushed Dr. Ellison to broadcast occasional updates. In one groundbreaking demonstration, streamed live to billions worldwide, a volunteer with crippling pancreatic disease underwent a novel procedure derived from the Regine research. Tiny engineered viruses introduced the active gene cluster into his pancreas, instructing cells to rebuild the damaged organ. Over the course of a week, ultrasound and MRI images revealed progressive changes. On the 8th day, the volunteer's critical blood sugar levels normalized without insulin injections. He reported feeling stronger, more alive, and fully functional. The repercussion of this demonstration was immediate. A wave of new hope for chronic disease sufferers, and a wave of condemnation from conservative voices claiming that humans were playing God. Debates on moral boundaries roared across social media dinner tables and legislative chambers, yet in the hearts of many, an inescapable question took root. Were these breakthroughs worth the risk, or did humanity stand at the tip of a biological arms race? As the breakthroughs continued, new layers of complexity emerged. High profile cases came to light. Professional athletes found marginal boosts in speed and endurance after minor injuries healed with negligible downtime. Some, considered enhanced or augmented, placed wagers on how far this new phenomenon could push human limits. Could it be a stepping stone towards superhumans? Or was that stepping stone also a moral sinkhole? Military institutions discreetly scouted individuals who showed a high degree of regeneration, aiming to recruit them for specialized missions. Rebels in conflict zones began hunting for healers among their ranks, hoping they could replace medics entirely. The line between medical marvel and weaponization blurred. Governments responded by formulating new regulations aimed at restricting the use of regeneration-based techniques to licensed facilities. But black markets flourished, with unscrupulous doctors offering unregulated procedures promising instant immortality. A few chilling stories involved individuals who believed themselves invulnerable, only to collapse from massive organ failure triggered by an unbalanced regimen of treatments. Caught in the middle of these swirling forces were ordinary families touched by tragedy only to be saved by the new leaps in medicine. One such story featured a teenage girl, Althea, who suffered third-degree burns across most of her body in a home accident involving volatile chemicals. In the past, she would have endured skin grafts and potential lifelong scarring. Yet, with advanced regenerative therapy, the scar tissue rapidly resorbed, replaced by smooth, healthy layers of new skin. Althea's recovery became a symbol of inspiration for thousands needing hope, and she traveled to conferences enthusiastically explaining how she regained her confidence and ambition. Journalists labeled her the Phoenix Child. Parents with children suffering from degenerative disorders flooded Regine's mailboxes. Once unattainable cures now felt close at hand. Each new success transformed popular opinion, gradually shifting from anxious wariness to acceptance. Medical insurance companies hesitantly introduced coverage options for regenerative therapy, albeit with sky-high premiums. However, the turning point arrived with the case of a soldier, Staff Sergeant David Connor, who was transported home from a war zone with a grievous torso wound. Conventional wisdom said he would die within hours. In a hush-hush operation, the Regine Project took immediate action, saturating his wound with specially modified stem cells and guided viral injections. Against all expectation, Sergeant Connor stabilized, and within days, a new lattice of muscle fibers formed, entwined with nerve pathways. Over the following weeks, as the tissues reached near complete integrity, he regained motor control and minimal pain sensitivity, leading a surge in public enthusiasm. Many who witnessed or heard his story began calling the phenomenon a new era in compassion-driven science, a living example of defying even the most final of predictions. Though the technologies derived from this discovery inspired an age of medical abundance, complexities multiplied. Scientists warned of psychological repercussions. For many patients who recovered from otherwise fatal injuries, the emotional trauma was not erased. Some experienced survivor's guilt, especially in tragedies where they lived and others perished. The knowledge that they had defied death forced them to wrestle with existential issues. Therapy programs expanded as the mental health community recognized that physical regeneration and psychological healing did not always mesh. Patients like Sergeant Connor found themselves grappling with unsettling questions. If near-fatal injuries were no longer an end, what meaning remained in typical human limits? And if the human body could bounce back from the edge, how did one's understanding of risk, purpose, or mortality shift? On the scientific front, new revelations emerged monthly. Once researchers determined that the gene cluster resided latent in many people, it became clear that some trigger, possibly environmental or triggered by severe trauma, smifted on. In labs, attempts were made to activate it deliberately, in vitro. Tissue samples from newborns revealed that the cluster might be present in far larger proportions than previously suspected. This hinted at a future of humanity that would fully embrace by birthright the capacity for accelerated healing. But there was another side. Certain subpopulations exhibited dangerous interactions with the gene cluster, such as immunocytes attacking healthy tissue. The ReGene project, alarmed by these complexities, tightened research progress. According to Dr. Ellison, the best course was methodical, cautious progress. However, the momentum-driving society was unstoppable, fueled by desperation for cures to aging and terminal disease. Many demanded immediate access to the therapy, disregarding that it could be lethal if improperly administered. As the world's thirst for knowledge about these breakthroughs grew, a once secret multinational summit was forced into the open. Representatives from major powers, along with leading scientific minds, debated how to standardize regulations without stifling beneficial discoveries. Some advocated for a universal healthcare system, distributing regenerative therapies, asserting human rights to these newfound advantages. Others voiced dire warnings of tyranny. What if authoritarian regimes used the technology to breed unstoppable armies? The summit ended with an agreement to form a new oversight entity, Global Regeneration Ethics Assembly, GREA, to devise binding standards for research and usage. Yet, no law could fully control the flood of innovation and speculation around the healing phenomenon. By the next decade, regenerative medicine units became fixtures in hospitals worldwide. For a growing subset of humans whose gene cluster was fully active, treatments were quick and minimally invasive. Life expectancy soared. Individuals found new ways to manage critical diseases, and amputations became rarities. Mortality rates from accidents and disasters plummeted. However, the cost in resources, the intricate therapies for those at risk of meltdown, and the psychological weight of witnessing the repeated defiance of death presented ongoing challenges. Philosophers argued that humans were forging a new path, neither purely mortal nor truly immortal, but flirting with a realm once reserved for legends. Religious leaders grappled with the spiritual ramifications. Scientists carefully tiptoed between hope and caution, still aware that any overreach could spawn something monstrous. Leaders across the globe found themselves faced with the sobering realization that while humanity had taken an enormous stride forward, not everyone would benefit equally. Clean water, stable environments, and well-committed medical facilities remained unattainable for many impoverished areas. The advanced therapies demanded skilled practitioners and cutting-edge tools. Camped in neglected corners of the world were countless individuals still dying of treatable diseases, far from the miracle that advanced society was celebrating. So, a new phase began, transferring knowledge and tools, bridging that gap. It started with volunteer programs where doctors traveled to remote communities, setting up small but fully functional regeneration clinics. Early successes there proved that tragedy did not need to persist, and that sometimes a single, carefully administered therapy could rescue entire families from multi-generational cycles of sickness. Stories began to emerge from these remote sites. An elderly woman in a drought-ravaged region was trampled by livestock but survived with minimal complications thanks to a traveling ReGene nurse. A child with severe malnutrition found that new nutritional regimens combined with mild gene therapy helped him recover almost fully within days. These narratives echoed across social media, shining a light on the radical transformations spreading through the global community. Detractors continued to question how sustainable it would be to maintain such revolutionary treatments for an ever-growing population. Others saw a window of opportunity for radical reimagination of society's priorities, placing universal healthcare at the forefront rather than as an afterthought. In the present day, celebrating the 10th anniversary of the discovery in Dr. Maitre's hospital, humanity stands perched on the boundary line between old truths and new potentials. The abiding fear of an unstoppable meltdown or uncontrollable mutation remains, but the thousands of survivors who have outlasted devastating injuries or crippling illnesses bear living testimony that the phenomenon is not only real, but can be tamed, at least most of the time. Cutting-edge therapies are refined each year, promising safer activation of the healing gene cluster and harnessing its power for tasks once considered impossible. Genetically guided regeneration has become a field rife with Nobel announcements, commercial patents, and philanthropic initiatives. Doctors, both novices and veterans, have adapted to a new mindset, diagnosing catastrophic injuries with a mixture of old caution and fresh optimism. Within this transformed landscape, each human life carries deeper resonance. People still face hazards and tragedies, but the once absolute boundary, death from physical injury, has lost much of its dominance over the human psyche. Medical professionals speak routinely of miracles that past generations would have dismissed as legend. Society's perspective on risk, fear, and possibility is shifting. No longer is a fatal wound a sentence to oblivion. Families keep vigil not merely with grief, but with the hope that the new knowledge gleaned from the Regene Project may yet intervene. While ethical and existential conundrums swirl in philosophical circles, the fundamental truth remains. Humanity, once bound by the fragility of flesh, has inched closer to transcending the limits of mortality. And yet, as Dr. Ellison often concludes in his lectures, this breakthrough has not made humans gods, merely participants in a grander cosmic design. Beneath scalpels and microscopes, 1,000 secrets still lie hidden within cells. Each person bearing the gene cluster stands as a testament to something extraordinary, yet unfinished, a puzzle whose edges have only just begun to show themselves. For every new door opened by these regenerative talents, 1,000 new questions arise. Nevertheless, the facts are indisputable. Once fatal wounds can be reversed, entire organs can be restored, and countless individuals who would have perished now walk the earth living second lives that defy all conventional endings. In the hearts of ordinary women and men, a spark of wonder endures. Grief is lessened, if not banished. Hope is expanded, if still measured by caution. If the collective achievements of countless researchers, doctors, and volunteers say anything, it is that humanity is no longer solely defined by its susceptibility to injury or its nearness to death's door. The age-old dread of mortal wounds and incurable diseases has started to crack, revealing a future far brighter than anyone dared predict. Indeed, the notion that death from physical trauma must rule over humankind has been challenged, and that challenge has been met, not by the superstitious or the miraculous, but by centuries of incremental knowledge culminating in an epic shift. Even as society continues wrestling with the forces unleashed by this transition, certain truths remain clear. With the gene cluster active and undergoing scientific understanding, the boundary between life and death is no longer the same. Countless patients, once condemned, now emerge from hospital wings with a spark in their eyes, a second chance clasped in their hands. The medical breakthroughs that have enabled this renaissance reflect the very best and most hopeful aspects of human ingenuity. Healing had never truly been out of reach. It merely waited to be discovered, shaped, and ethically applied. Through adversity, fear, and rigorous pursuit of knowledge, humanity has defied death in a way once deemed impossible, forging a path into a new era where possibility eclipses inevitability, and healing stands at the core of progress.